Welcome to the Team Teach podcast. I'm Clare, and in each episode you'll find me talking with an expert guest to learn more about behaviour. We squeeze a lot into each episode. You'll listen to the latest thinking in behaviour, continue your professional development with our book recommendation, and then I'll send you away with 3 practical tips you can use in your setting. I'm joined today by Dave Smallwood. Dave is a Principal Team Teach trainer and Company Director of SENse Training and Consultancy. He's worked in special schools for both the local authority and for the National Autistic Society. As a staff development coordinator for the National Autistic Society, he's also delivered and developed training in autism, equality, diversity and rights. Dave is also an occasional co-host of the Team Teach podcast. And today, Dave and I are talking about autism with a focus on masking behaviours. Enjoy the episode. Hi, Dave. How are you?
I'm good. Thank you, Claire. How are you?
I'm very well. I am excited, actually, about the topic we're looking at today, which is supporting autistic individuals in our services, and particularly thinking about a focus around masking behaviours and maybe touching on the prevalence of masking behaviours with girls. It's not a catchy title that I've just named it. It will be catchy, I'm sure.
It's not very catchy, is it? No.
No.
But very interesting and very exciting nevertheless.
Exactly. Let's start off just with a quick intro to yourself, Dave.
Yeah, I'm Dave. I'm a principal trainer for Team Teach. I have worked for many years in autistic settings, special schools, autistic residential schools. So yeah, that's it. It's been my life's passion, really.
Yeah, no, I'm really excited to have you co-hosting today, actually, because I will be trying to pick your brains, I'm sure, about some of the things that's going on in my provision that I work in. But my name's Clare Edmondson. I'm also a Principal Team Teach tutor. My background, like Dave, is in education, but I've also worked in mental health, and I've worked in different autistic provisions, and currently work 1 day a week running interventions around literacy and quite therapeutic interventions for autistic young people. So this topic is really on my mind because some of the individuals that I support at the moment definitely have behaviours that are very much masking. But it'd be good to start off with our reflective question around what you wish you'd known then that you know now.
Yeah, we were discussing this earlier, weren't we? Something that's, I thought it's really come to me quite recently. It's really been highlighted to me recently, I should say. I've always been aware of it, but we do on our Team Teach training a section on personal space and body language, and within that we get people to step into other people's personal space, at which point we have a look at any emotional responses that we can provoke in people, and one of which is people smiling and laughing and giggling, which we talk about, and it's a defense mechanism, trying to diffuse a situation possibly by smiling and showing that we're not a threat. But that smile comes through awkwardness and nervousness, and actually could show a little bit of fear possibly, or unhappiness. And what we do in some of our settings is we have some wonderful pictures of smiley faces, and we teach individuals that a smiley face often means that people are happy, when actually it doesn't. And I think when we're talking about masking, individuals will emulate social norms, if you like, and one of those might be smiling. So they'll show people, I'm smiling, so therefore I'm happy. And I think it's something we need to be careful of. With emotions, and when teaching emotions and emotions coaching, actually happiness isn't always about smiling, and smiling is not always about happiness. And I think that's something that I wish I'd known then, that I wish I'd known now, that I do know now.
That you do know now.
Yeah.
You do definitely know it now. It is fascinating, isn't it? That when we're looking at body language, facial expressions, that everything's almost a stereotype, isn't it, of the emotions. And we are scanning the individuals that we work with for the norm, in inverted commas, of responses. And I think similar to you, I kind of wish I knew that actually that those cues, non-verbal cues, aren't always the full picture. And I was working with someone a few years ago and he was laughing. So I joined in because I would, just like to join in a bit of a laugh. It's kind of a bit contagious. But he was like, "Why are you laughing?" And I was just like, "Oh, because you're laughing." But he was like, "It's not funny. I'm like, I don't feel happy. I feel angry." And that interaction was really interesting because I don't know, I don't even think this is necessarily masking, but he just had a disconnect between what he was feeling and then what he expressed. And I think masking is very similar to that in the sense that someone is maybe repressing their true self because actually then perhaps it's easier to fit in. But I just didn't really have that understanding around masking and that understanding around difference, I suppose, in those nonverbal cues. And it just takes that self-reflection, doesn't it, to get there and to be like, oh, okay. And actually just joining in with someone laughing because they are is quite I don't know, it's a bit like it's catching, isn't it? But it doesn't necessarily mean that the other person's happy or finding something funny. It was quite a shift.
Yeah. And that's what we do in social situations, and it's a social communication, isn't it? And a togetherness. And it's not always to do with happiness. I mean, I've also known individuals that can seem very unhappy, and we can be quite nervous around them, possibly with some of the repetitive behaviours that you might find, rocking, noises that somebody might make. But really, what they're saying is, "I'm calm, I'm happy, I'm regulated." Yeah, but these are the things that we will see potentially in autistic people, but it's when we don't see them. The masking, that's the concern, isn't it? So people masking, some people, some individuals might learn ways of interacting by emulating what other people do in social situations, and they learn quite complex social communication skills, but really it's emulated and it's spotting those things. That's the difficulty, isn't it?
And it is hard to spot masking because, as you say, if someone is emulating, copying those social norms or those societal expectations, then actually on the surface it can seem like that individual is doing really well and emotionally is really regulated. And I find that difficult in the provisions that I've worked in over the years, where that disconnect is tricky because what can happen is that someone masks so much, but there's only, I don't know, so far you can kind of push your actual identity down. And then for me, in the services I've worked in, it can spill out in behaviour or in self-injurious behaviours, or spill out at home maybe, where someone feels perhaps a lot safer to be unmasked than in, bigger social situations, or vice versa. So it is one of those behaviours that I do find tricky in my services, because we care and we want the best for the individuals that we work with, and it's hard to spot, and it's concerning, isn't it?
It is, yeah, it is concerning. It is. You're right. I think the National Autistic Society describe it as meltdowns or with withdrawals, yeah, we notice the meltdowns. We notice the outward behaviours, the larger eruptions, if you like. But what we don't see so much of is people withdrawing, and it's when somebody's quite quiet, and that's why masking, as well as masking autism potentially, then it comes kind of hand in hand with mental health issues. So you find a lot with individuals with autism, especially when they're masking, quite a lot of mental health issues come along with it as well.
Yeah, there's a study by Bradley in 2021 that shows really the depth of how masking is detrimental to mental health. So it's a pretty recent study, and then there's one from Hull and his or hers colleagues from 2019, and that's from the Autistic Society as well, and kind of cited on their literature. But I was reading that and researching a bit for this podcast and just thinking about that. And I suppose it is so concerning because of that. The evidence is there that it has such a detrimental impact on mental health. And sometimes in my services, you can see that playing out a little bit, and the behavior spilling out. And I mentioned earlier around self-injurious behaviors, but it has to go somewhere, doesn't it? If you're not able, or you don't feel able to, or are not able to express who you are and your true identity, then that's going to have a huge impact. Yeah, it's difficult.
It is. It does have to go somewhere. It does. And then we get these behaviors coming out in themselves, and yeah, it's really it's difficult. It's hard for me to put into words, but it's living in a world that makes no sense or not much sense. And then where does it come out? Where do we vent? So a lot of the time it's at home and they're in private, possibly. And it's difficult. It's difficult to support.
When we say that everyone can benefit from Team Teach training, we really do mean everyone. Our in-house training puts the emphasis on the unique needs of your setting and creates a consistent approach to behaviour across your entire organisation. Head over to the Team Teach website to find out more.
So I guess I'm thinking for the listener, it might be helpful for us to think about some of the reasons why individuals might mask. We've already talked a little bit about societal acceptance and kind of copying behaviours, but what are some of the other reasons for masking?
To fit in. They want to fit in with everybody else, trying to do what's expected of them, not fully understanding what's expected of them. So what can I do to fit in? So I think that's why they'll mask. They'll see other people around fitting in socially, and then think, how's that? I'm talking about it though in kind of conscious thought, if you know what I mean. I'm going to mask now because everybody around me is interacting in it, and I want to be part of it. I don't actually think it is a conscious effort. I think a lot of the time it's subconscious, and individuals don't always know, which is why we find a lot of individuals getting diagnosed with autism later in life, because they've not been aware that they're masking, but they've always had that awkwardness and found it difficult to fit in. So you'll find a lot will be quite quiet and subdued, observant, and then form these social norms. So it's about all these things that we think of as social norms, should we say. And I think that's why people would mask. I don't know, what are your thoughts on it?
Yeah, I really agree with all of that, that there's a pressure to fit in, and that pressure, an individual may not even be conscious of that pressure, but it's always there. And I'm particularly thinking about adolescence, I suppose, because that's a time in anyone's life where we are so much more conscious, aren't we, of our peers and wanting to be part of the crowd. And that's all part of kind of, I'm going to say normal, in inverted commas, kind of adolescent development. So I think that pressure to fit in and desire to fit in grows around that period. And I'm also thinking about girls, autistic girls, and how you were mentioning where diagnoses can be quite late. And that's true of girls with autism, where sometimes, not always, but the evidence kind of points towards that adolescence is a time where suddenly we start to see girls or autistic girls' traits coming out more. And because they've been really successful at masking and successful at appearing to fit in, appearing to go with the crowd. And I think it gets harder as time goes on to keep that facade up, because it is a facade where you're almost repressing, your true wants, needs, and identity.
Yeah, and I think it's difficult. Sorry to.
Yeah, go on.
I think you're right. At that time of life, the pressures are massive, especially when you get to kind of secondary education, you get into high school, and then everyone's starting to grow up around you. You're thrust in with lots and lots of people that you might not know that well, so you try a little bit harder to fit in, because the other people that you've been with throughout your life have been there since you were a baby, really, and you've grown up with them. And now I've got this whole new set of people that are almost adults, and you need to try and fit in. But what I've seen, what I've witnessed myself, is individuals that don't have a diagnosis of autism, and then they're trying to mask and finding it quite difficult, especially within adolescence. And then when they get the diagnosis of autism, it's like a switch. And the autism doesn't go away, but it's like a realization of, I get it now. I know why I've been behaving like this. And then it kind of the masking dawns on them. And it's a kind of, it's all right. It's okay, actually. I'm autistic. I understand now. And that's okay, because nowadays we're all quite well educated with autism. And suddenly it's not that they start fitting in, but they start being all right with their own behaviours.
I'm also just thinking about time, Dave. I don't know how we do it. We're just like, and then we've already hit the 20-minute mark of a, short dive into the topic. So
I want to do a part 2 on it.
I think I do. I think there's lots in it. And I think if we do, we can do our top tips now, and maybe there's a particular area we might dive into as a part 2, because I think there's so much on this. I think it's really interesting. But yeah, give us one of your top tips, and I'll do a couple after.
I think it's the emotions. If we have someone that's quite quiet, possibly in our service, and sometimes they smile at things that you think, wonder why they're smiling at that, or they laugh, and it's a bit of a random time to laugh. It's those little subtleties that we've got to be looking out for, I think, with the masking. Yes, we'll see other types of behaviours, repetitive behaviours, the stereotypical repetitive behaviours that you might find with autism, possibly flapping of hands, rocking backwards and forwards. But with the masking, you might not see that as much, but you might see it a little bit more subtly. So, I mean, people do have behaviors to help them regulate. We all have a certain amount, but it's those repetitive behaviors, the stereotypical behaviors you might find with autism. So those types of behaviors, and also the show of emotions, but at random times, but very subtle ones. Yeah, so that's it. Do you want me to reword that?
No, I think that was great, David. It's like just really reiterating some of the bits we talked about at the start, wasn't it? About how those small cues that we see that seem to be a bit out of place can be a sign of masking. So I think that's really helpful for the listener to know. And I was also thinking, it hasn't really come up as we've discussed, but some of this is about the social norms and social cues and social pressures. So actually in our services and at home with caregivers, promoting that ethos of inclusivity where it is okay to be different and it is okay to be diverse, and having diverse literature and having diverse conversations about autism or about people that are just different and act differently. I think that as a service wide and work to do with caregivers is really important, because having that safe environment to express ourselves in our individual unique ways will be really helpful for anyone, but for particularly someone that's masking, they may feel more comfortable to be able to be more their true identity, their true self. And then I wanted to link back as well as the final top tip, just about parents, carers, caregivers at home, to just emphasize that link together is so important, because caregivers know their children, their young adults, whoever they are living with, that they know them best. And actually that relationship that we have with caregivers can help us in service, perhaps to uncover some of that masking that we just had no idea that was going on. So that communication, building those bridges, I think a joined up kind of approach would be really helpful with this type of masking.
Caregivers and families, they do they do know their loved ones best. But with that, I think we need to have a kind of openness and encouraging openness. I mean, we know you know them best, we know you love them, but we also need a bit of honesty as well, and know your loved one's strengths and things that they find difficult. It doesn't mean that you love them any less, but being aware that they're a bit awkward in social situations, that's really key information. So we shouldn't keep that secret and worry that, oh, what are people going to think? As caregivers and families, we should also be open and honest and say, no, my loved one does really find it difficult in social situations. They laugh at funny odd times, and they look confused when I make a joke. That's all really useful information. So it doesn't mean that we love them any less. It just means that we're going to get them the proper support.
Thank you so much, Dave. It's been, really interesting topic, and I think definitely scope for a part 2 and a bit of a dive into an aspect of masking. And thanks for your time today, and I'll catch up soon.
Thank you, Claire. Great to speak to you, and catch up soon.
You've been listening to the Team Teach podcast. It's been great to have you here with us as we discuss behaviour, communication, and the ways we can best support those in our care. Thanks again, and I'll see you next time.